Hi, I'm Ann Mailer. I'm a certified nurse midwife, and I'm here today to talk about my journey as a newly diagnosed type 1 diabetic. And we'll see if I can do this without tearing up at all. June 10th of 2023, I was admitted into the ICU in diabetic ketoacidosis. Now, leading up to that, and I'm highly educated in the healthcare field. I've taken care of gestational diabetics, so I have a lot of knowledge. But for myself, I was healthy. I was 40. I worked out. I ate good. So when I started to experience symptoms, I think maybe 3 times throughout the process, something popped up and was like, do you have diabetes? And I'm like, there's no way, right? And my mind totally dismissed it. Totally. And I have learned that your mind is a powerful thing. I've always known that. But when your mind really is telling you one thing, you can really dismiss things. So anyhow, months leading up to that, I was working part-time, opening a business, and I was feeling tired. And I just thought, I never take like midday naps, but I just remember feeling very fatigued. But again, just kind of dismissed it, right? It was just a general feeling. And then over time, I was getting a little bit more thirsty. And again, in hindsight, I was drinking a little bit more. I was tired. Again, I just chalked it up to being busy. I'm a single mom. I'm taking care of a house. I'm, opening a med spa. I'm working part-time. And so I just thought, you're just doing a lot. And I was just being kind to myself and resting, still going to work out, eating healthy. And eventually it got to the point where those symptoms just kept worsening. And one day I was driving and it was like out of nowhere, everything was blurry. I'm like, what the hell? My vision just changed. I've had LASIK eye surgery. Everything's been fine. And my daughter had come to visit me a few days prior and was like, Mom, are you losing weight? And I'm like, no, I don't think so. And I don't really weigh myself. I just know what's normal for me. And she's like, oh, well, your thighs look the same size as your calf and it just looks like you're losing weight. And I was like, I'm not trying. I don't think so. I'm eating. I'm, working out, doing my thing. So there was that too. So then this sudden vision change really scared me. I'm like, oh my God, what if like something serious is wrong? So I try and get in quickly to an eye doctor, which it was not quick. And I got in to see an optometrist. Typically I see an MD, and I told the optometrist, hey, my vision quickly changed. He looks at my eyes, he does everything, and basically tells me, he looks at me and says, your vision has changed, you have dry eyes. That was the other thing, I had dry eyes. I almost forgot. So you need glasses. And I'm like, this doesn't make sense. I'm like, this was a sudden onset. So he looks at me, he gives me a prescription, and he's like, this will be permanent. And I remember looking at him and saying, this is not going to be permanent. Something's not right. And so at that point I left. I did get the glasses because I did want to be able to see it. When you're driving and you can't read a sign, it's a little scary. And I was just like, what is going on? So I schedule another eye appointment, this time with an MD, because I'm like, maybe he's going to look into other causes for my vision change. And at this time I'm getting a little bit more thirsty. I'm more fatigued. I'm waking up with these horrible cramps at night, and the cramps are starting, and I don't know, this is probably over a month still, right? The cramps are really, sometimes I would get leg cramps at night, but these are getting severe, like to the point where both legs are contracted and I can't move. So now I'm taking magnesium supplements, drinking liquid IV, which is full of sugar. And again, I can say this all in hindsight now. And by the time I got to the second eye doctor, I was feeling awful. And I remember going into the office, and this poor girl, and I'm a provider, right? I sit down and I just start crying. At this point, I'm like, oh my gosh, you have dry eyes, dry mouth, your vision has changed. I'm like self-diagnosing myself with everything but diabetes. I'm like, you have Sjogren's, And so I'm like, he's going to do a test. I'm making him check my eyes. I'm putting eye drops in, like waking up in the middle of the night. I was stumbling to the bathroom to pee, but I thought it was just because I was drinking all that fluid. And he basically blows me off too, tells me I don't have Sjogren's. He did the test. Your vision has changed. It's just what happened. Use these eye drops. You're fine. So at this point, I was going to one of my colleagues for my yearly women's health exam. And I told her, I'm like, I was crying. And I said, something is wrong with me. And she's like, Ann, I'm worried about you. You don't look good. I'm like, I don't feel good. I feel awful. And I'm telling her all my symptoms. And at this point, I'm like, and I think I have a yeast infection. And she's like, do you think you're diabetic? And my exact words, I'm like, how the fuck would I be diabetic, right? How the hell? I'm like, look it. She goes, I don't know. And she's like, maybe we should do your finger stick. And I was like, no, just get my blood work. I said, I'll go down and get my labs drawn. But my insurance at the time wasn't real insurance and it wasn't great. So I was like, well, just get my blood work and see. But I was like crying to her. And then of course she did my exam and she's like, oh my gosh, you know, your vagina's angry. I'm like, of course it is. I told you I have a yeast infection. So anyhow, you know, I was feeling like death. So I go and get my labs drawn. And again, I think a couple times prior to that, like some other symptoms that kind of popped in my head, like the one night when I was like really going to the bathroom, I'm like, are you diabetic? And then there was another time where I was like sitting on my knees on the ground and I felt like tingling in my toes. I'm like, gosh, is that diabetic neuropathy? And another thing I had was I had my dishwasher open and my shin hit it and it was like, it's a metal one and it cut it a little bit and that cut was taking forever to heal. And I was like, what the hell? Right? And again, in hindsight now, it's like, check, check, check. But at the time when you're in denial and you're like, you've been taught that type 1 diabetes only happens to children or, you know, is most likely a childhood diagnosis, you don't even think it. And I wasn't a candidate for type 2 because I was healthy doing the things I needed to do. This morning, thank God for my chart and Epic. I remember, well, that was Friday. So Thursday, let's back it up a little bit more. I like to dance. So I do salsa and bachata. It was something I picked up after my divorce and it really lit me up. And I remember I worked 12 hours as a midwife. I was feeling like shit, thirsty, but I really wanted to dance. And I went to dance that night. So that was Thursday. And I could barely get through a dance without feeling like so out of breath. My mouth was so dry. You would have thought that I smoked so much marijuana that my mouth was just sticking to itself. And I remember drinking and thinking, geez, you know, something's not right. And I ended up leaving dance early. And then that night was rough again with the cramping. And I was taking my magnesium supplements. So then Friday, remember, I went to my second eye doctor, then followed immediately after, went for my pap smear. And my midwife was like, are you diabetic? So she has her thinking cap on. And I'm like, no, there's no way. So anyhow, I go to bed that night and I'm feeling horrible. I had called my daughter to stay with me overnight, which I never do because I was feeling so bad. So I remember waking up that morning. So now it's Saturday morning and I felt dry, like to my chest. And I was like, oh my God, what is wrong? And I remember looking at my phone and it was like, you have an alert, you have some, results. And I was like, oh, let me look at my results. And my sugar came back 286. And I remember laying there going, how is my sugar 286? And I called my colleague. I'm like, did you see my sugar? And of course she didn't. It's a Saturday. She's doing her errands, whatever. She's like, no, what is it? I'm like, it's 286. Like, what the hell? She's like, Ann, you need to be seen. I'm like, I know, but like, who's going to see me? And so I'm trying to get a same day appointment. She's like, Ann, maybe you should go to the emergency room. I'm like, oh, they're just going to send me home. They're going to say I'm fine. And I remember I had some coaches at the time that were helping me with my business and they knew how bad I was feeling. And I remember I had talked to her and she picked up the phone and called me and she said, Ann, why aren't you taking yourself to the emergency room? And I'm like, well, I don't know. What are they going to do? I'm just trying to get in for a regular appointment. I don't think this is like an emergency. I'm not like 500 or 600. Yeah, this isn't normal. I feel like death, but... And she's like, Ann, what would you tell your patient to do? And I was like, I tell her she needs to be seen and she needs to go to the emergency room and be seen now. And she goes, okay. Oh, and that was the other thing. I said, hey, I have my dance performance tonight. I said, I want to be there. And she's like, okay. She's like, why don't you just pack your bags? I mean, this is how, like, I was not thinking rationally. She's like, pack your bags. It's early in the morning. You still have time. Go to the emergency room, see what they say. But I'd pack some bags. I said, okay, fine, good idea. And at the time, I was working on recruiting models for my business and making a post. So I drove myself to the I packed up my bags. I brought my iPad so I could work on my business stuff. And I remember I walked into the emergency room. I really didn't feel well. And, they said, what brings you in? I said, my sugar's through the roof and I feel like shit, my exact words. So I'm sitting there waiting to be called. They take me back. The nurse was not very friendly, probably because they're overworked. And as she's drawing my labs, I'm like, can you get a hemoglobin A1C while you're at it? She's like, the doctor will have to decide. I'm like, can you please ask them if they'll get a hemoglobin A1C? Because now at this point, I'm like, what the hell is that if my sugar's here? And I hadn't eaten... I drank liquid IV overnight and I was drinking lots of water, but I really hadn't eaten in 12 hours. And now my sugar's 370. And then first they want to get my urine. So I'm sitting there working on my stuff. And in the meantime, so they had me in the hallway because the emergency room was so busy. So they put me in the hallway and I was waiting. And then they're like, we need your urine. And I'm like, okay. So I left them a urine sample. And then all of a sudden I have no call light, because my room, they didn't think I was urgent until they got my labs back. And this doctor comes up to me and says, you're diabetic. Before we looked at you, when we looked at your chart, we thought you were newly diagnosed type 2 diabetic, but we think it's autoimmune. And of course, all I hear is diabetes. And I'm like, I just start crying. And she's like, we need to take you to the ICU. And I'm like, I didn't even care about going to the ICU. I'm like, what do you mean I'm diabetic? And I said, I'm healthy. And I remember one of the doctors looked at me and was like, yeah, well, in 2021, you were healthy and now you're not. And he thought he was being funny. And I didn't think he was funny. Like when he walked away, I just started crying because I'm like, what have I done? And then the doctor from the ICU came, people were trying to get IVs and I quickly got moved over. But I remember it was like such a shock and devastation. I was like, how did this happen? And I had no idea what was coming next, for me or what this was going to entail. At the moment, I was like, holy moly, I'm diabetic. How did this happen? I did everything right. And here I am. So it was the start of my grieving process. But in the time, I would say my favorite nurse was my ICU nurse that took care of me when I first arrived. I remember them saying, you're the best looking DKA patient we've had. And I was like, well, whatever that means, and I could walk and talk. I'm sure they're used to admitting people that are, unconscious and everything else. And to be honest with you, I was probably really close to something bad happening. So, good thing I took myself there when I did. But that was the start of my journey. And the grieving that was going to follow, nobody could have prepared me for. I will say after being in the unit, I started to feel more normal, I'd say. But yeah, that was the start of it. And then my actual hospital stay, was quite interesting because my sugars were all over the place. So they started me, after I got off my drip of insulin and into the regular floor, I was started on a long-acting insulin and a short-acting one for, before meals and things like that. And something I learned, or a term that people kept saying to me, was, you're honeymooning now. And I was like, well, what does that mean? And it's like, well, now your pancreas has had time to rest, and the little bit that is working, sorry about my dog, is starting to kick in. So basically my sugars were just up, down, up, down. And it was a lot to juggle. And I remember asking to stay another day because I really wanted to see that my sugars were controlled and that, I could manage this on my own. I had never dosed myself for insulin. I didn't know what I was doing. I understood, right? I understood insulin, I know how to give an injection, but I didn't know how to dose. And I remember anxiously waiting, in a good way, for the diabetic educator to come through, and not to give me a pathology of what's working and all that, but just to understand. What I was hoping to gain from this is, what do I do now? And she's like, well, she got there and she explained all the pathology. She did a great job. And then she was like, if you're going to work out or exercise, you just give yourself a little bit less insulin. I'm like, well, what's a little bit less insulin? And she's like, you just lower it a little bit. And I thought, they just put you on this standardized scale. And I was just like, okay. And I think I was looking at her like a deer in a headlights. And she goes, after she was done with her whole big spiel, she's like, is this helpful? And I said, no. And I said, and I'm highly educated. I said, so I don't know what the average person does that doesn't have the background I do. I said, but I am not feeling great. So they buy me an extra day in the hospital. And my hope is that I'm magically going to be like, boom, my sugars are going to be controlled and I'm going to know this in a couple days. And what ended up happening is, since COVID, the staffing was so bad, they missed checking my sugars. They were late giving me things. And finally I said, you're probably going to be better off at home. So just go home. So, I get discharged out of the hospital. And my first night home, my sugars were in the 400, and I remember sitting there going, okay, well, I don't really know how many units to give myself. I know what they gave me, because I was scared I hadn't eaten, right? And I'm like, well, I know they gave me X amount of units when it was here. And I don't know, I was just scared. I didn't want to bottom myself out. I didn't know what was going to do what. So I remember giving myself a few units and, being nervous. And at the time I had a Libre continuous glucose monitor. And let me tell you, this was my life, staring at those sugars. It was not a life. Along with books trying to calculate my carbs. I had never done carb counting before. And writing everything down. And I just remember thinking, this is not controlled. And I wasn't even going to see an endocrinologist for, I think, a month. So I'm like, I'm not doing this for a month. I'm going to end up back in the unit. And because I was a provider at the hospital where I was admitted, I had some back end way to get in and get some help. So I was able to call the endocrinologist that was on call. And I said, hey, I just got out of the hospital. I'm a newly diagnosed diabetic. And I was still waiting to know for sure it was type 1, right? That's what they were thinking. But I was still waiting for this other lab to come back. And he's like, oh yeah, I oversaw you. And this endocrinologist, bless his heart, every day talked to me for 3 or 4 days until I got in early to see somebody else. Without him, my sugars would have been everywhere. And he would say, okay, do this much of the long acting this time. You're honeymooning, the best thing for you. And by the time we were talking, then my labs came back and I said, well, I'm confused. This one shows this. Am I a type 1? And he's like, oh, honey, there is no doubt in my mind. You are a type 1, so let's put that to rest. He goes, and the best thing for you, for your management, is going to be getting you on a pump. So I'm like, okay. So now, you're waiting a month to even see your endocrinologist. And now I'm like, just give me my damn pump, because my sugars were up and down. But bless his heart, he was titrating my insulin sliding scale for me, telling me what doses to take for my long acting, because once I put that in, there's no taking it out. But I was still honeymooning, right? So it was still up and down, and I felt like I was just eating to keep up with the insulin. So I finally get in to see the endocrinologist. In my mind, I'm thinking, they're giving me a pump today. No, that's not what's happening. She sent me for pump education. I'm like, well, why can't you order it today? Like this, I can't live like this, So the system was a little flawed. So she puts in the pump education. Then they told me that was booking out 3 months. 3 months. And maybe I sound spoiled, because I know some of my friends that are type 1 diabetics, they lived off of injections for years before a pump was even available. But now I'm like, okay, if this is what we have available and this is going to control me the best, why is this not like, boom, instant? And I understand there's some educating and stuff that has to go on with it. But from my standpoint, it's like, I can handle this. I'm knowledgeable, but I don't want to be living like this. So anywho, They end up misscheduling, so they told me that's booking 3 months out, and then I call again, put me into an earlier appointment. And in the meantime, some days had gone by, and I reached out. I had another girlfriend I had met that we really kind of clicked. Our kids are in the same grade, and I remembered she was a Type I diabetic. And I had reached out to her and sent her a Facebook message and was just like, hey, I was just diagnosed with diabetes. I know you have it. Look, I tear up. If you have some time to talk, let me know. She reached out to me instantly and was like, do you want to come over? And she works for Dexcom. And I said, sure. She's like, and my Libres kept falling off. And she goes, come on over. I'm just, come over if you can. And so I came over, and I remember walking in the door, and she's like, how are you? And I'm like, I'm trying not to cry. And she's like, give me a hug. She's like, it's a horrible, thing. She goes, I was diagnosed, I think it was like 9 or 10. She goes, and I'll never forget it. She's like, it's a lot. And I remember she hooked me up with a G7 and said, use this, and sent me with some. And then she started following me, and she told me, and she checked in with me, and was really God sent until I got things figured out. And then I told her what was going on with me trying to get my pump and my pump appointment. And she's like, I know you want to stay with this hospital system, but would you consider this provider? And I was hesitant to go to the other hospital just because I had worked there and I had had a traumatic experience, and I was scared to leave what was familiar to me where I was. And she's like, I really wish you would, Dr. So-and-so, who's been taking care of you, used to take care of me, but when he stopped seeing patients outpatient, I went to this provider. She's the Type I diabetic. She goes around, speaks nationally, all over about pumps and technology. She's wonderful. Would you at least talk to her? Fine. So she messages her, and the provider, she's an NP, messages me, and we talk, and she's like, listen, you don't have to be married to me. This doesn't mean you're locked in with me forever, but, and then my first appointment, she got me in that week and ordered me a pump that day. And within a week I had a pump, and then I was set up for pump training. And then she held my hand every day and was watching things and tweaking my pump, and just kept saying, you're honeymooning. And I'm like, okay. Or she'd say, I'm worried before I got my pump. I'm worried you're going to bottom out. I want you to eat a little bit of apple with peanut butter tonight. And just God sent. So all of a sudden, like this diagnosis, but I had all these amazing people stepping up to help me, which was good. I was very supportive because it was overwhelming. It was just a life. You didn't realize how much you have to think about everything. There was no more just picking up food and eating it and not having to wait to time it, and all of that. And what had happened with the other hospital, why I transitioned, is because when I finally arrived for my pump teaching day, right, I had already seen their endocrinologist. She said I needed to get pump teaching, or education before they would even order the pump. It was their policy. And then I get to the appointment, and the woman's just talking to me about like regular carb counting, and I already had that in the hospital. That wasn't what I was there for. And I said, I'm confused. I'm supposed to be here for pump education. She's like, oh, no, that's not what I have you down for. I'm like, well, that's what they ordered, and that's what I was told. So basically another whole visit was wasted before I transitioned to the other hospital, and I was ticked. So now I was going to have to reschedule and wait longer, and I'm like, this is unacceptable. And I think the woman felt bad, but it wasn't her fault, right? But I just thought, what a mess this system is. Like, yeah, I get it for people who like don't know, or they need a little bit more assisting, who aren't in my situation, but like we shouldn't just have this black and white, this is what we do for every person. So that's what made me transition to the other hospital system. And again, that provider saw me the first day, ordered the pump. The pump was here within a week, and then I had training right away. And I'll break this up, but anyhow, long story short, I just remember feeling so scared and thinking I'd never be able to eat fruit again, and how much of my life has changed and how vulnerable this diagnosis had made me now. Like, what if something happens and I live alone, or my sugar crashes and I don't have somebody close by? So there were so many like fears, and then anger, like, why did this happen to me? You know, I'm healthy, I did everything right. And I had to not feel bad for myself, because I do believe everything happens for a reason. But I just remember how much it rocked my world. And as I was going through the process and things went along, I just remember at times waking up at night, like with some ideas or jotting things down about my experience, and feeling this need to maybe talk about it one day, but I didn't know when that day would come. But yeah, it was a process, and I still kind of grieve it a little bit. You know, feeling unattractive with a device on you. I remember the day I came home from my pump appointment, and I was like, I remember sitting in the car and being so grateful that we have the technology, right, that can make your life easier. But at the same time, feeling so sad and angry that like I was going to need this device to stay alive, you know, and keep me out of the hospital. And it was that duality of being like so grateful that we had the technology and how far everything has come to, holy crap, my life just changed drastically. My point is, it was such a grieving process. And I don't know how parents do it, like with a kid, you know, if they don't have any medical background, or and they don't have the knowledge that I had. How do they manage that for their kid? How do you teach a little kid, right, to adjust to this new lifestyle? And my point is I think we know healthcare. I know healthcare is flawed. That's not new. I think the pandemic brought awareness to that. But it's like, we need better support for newly diagnosed type 1 diabetics. If I didn't have the luxury of being a provider and having connections that connected me to hold my hand through the first 3 days until I got in to see the endocrinologist, you know, that held my hand for months, let's say, out of the goodness of her heart, not even, you know, all the visits. I mean, I did have visits with her, but, and somebody else who hooked me up with a G7 and gave me things. I mean, it's just like I had this surrounding. All of a sudden I was supported by type 1 diabetics that I knew, like, two, you know, but I never thought I was going to need their support in this way. So I think we do need more support for people that are newly diagnosed, and a better follow through when they leave the hospital, because it is so life-changing. And I used to think a type 1 diabetic just needed insulin. I did not realize how many decisions they had to make on a regular basis, how many extra steps they have to take. And, you know, like I said, I'm knowledgeable in the healthcare field, except healthcare taught me wrong to say it's mainly a childhood disease, because it can be diagnosed at any age, which I think needs to be stressed too. So anyhow, my hope in kind of creating this channel, talking about it, opening up about my story, I know this was kind of long and winded, but is just to bring some awareness and help people understand that the grieving process, that duality of feelings, is so normal. You know, it's okay to be angry, because I was angry. And I still tear up about it, because to me at 40, like 40 was supposed to be my year. That was what I claimed. And this really rocked my world. So hopefully my story will help other people know that they're not alone. And, you know, I'll keep popping on with other tips, tricks, things I experienced throughout the process. And hopefully one day we can change the system a little bit so there is more support for newly diagnosed type 1 diabetics, and even throughout their diagnosis, because I think it would be wonderful. Somebody should have somebody following them for at least the first year, maybe even longer, depending on, you know, what's going on. And the pump shouldn't be such a fight to get a pump when we know that that's standard of care and the best treatment. story, and I will continue to hop on and talk about things. Thanks for listening.